Welcome to the Rights Track podcast, which gets the hard facts about the human rights challenges facing us today. In Series 5, we're asking, how does tackling SDG 8.7 and the fight to end modern slavery by 2030 work together with the UN's other sustainable development goals to achieve the single aim of creating a better and more sustainable world for us all? I'm Todd. In today's episode, I speak to Leão, professor in the Department of Collective Health at the Federal University of Mato Grosso in Brazil, about the connections between SDG 3 on good health and well-being and SDG 8.7. So welcome to this episode of the Rights Track, Luis. It's great to welcome you here from Brazil. Your expertise is really around public health, and interestingly, you're in a department of collective health, which is not an expression I've heard before. We talk about collective rights, but I've not heard of something called collective health before. So can you explain to me what collective health is, and then we'll talk a little bit about the work that you do in Brazil.
The field of collective health is very an American Latin creation. Is created more or less in the middle of the last century, and it makes the merge about very different issues like epidemiology, public policy, management in general. The most important thing that created this field of knowledge is the influence of human and social science. Collective health is just an amplified way to see the health of populations, because when we think in health, we generally think in people wearing white, in some diseases. This is medical field. When we think in collective health, we open a window to understand the paper or the whole of populations and take the health in their own hands in terms of power to face the determinants of health.
I understand. So, you're making this distinction between what people would perceive as the medical approach to health, which is white coats, doctors, hospitals, nurses, people going to hospital and getting a treatment, as opposed to having responsibility for the way in which one's socioeconomic status and sort of conditions affect one's health. And
Exactly.
There is a responsibility, in a sense, for people to understand this more holistic understanding or holistic sense of health.
My journey to collective health began when I was a psychologist, and I was attending a very poor worker from a rural area in Brazil, and he had a stuttering problem every time in front of me during the psychological care. The narrative was associated to a humiliating situation at work. Then I realized that the psychoanalysis in that moment is not enough to understand what is going on. I realized that the power of work is very deep, is a powerful determinant of health. Then I moved from psychological field and went to collective health. I did a lot of studies in the influence of work on our health.
Okay, so the connection then between conditions of work, conditions of health is quite strong in your mind and in your research. So perhaps you could tell me a little bit about the state of public health in Brazil. When we are outside Brazil, we see it as a powerful state, more than 200 million people, huge landmass. The recent election of Bolsonaro's refocused attention on Brazil in terms of the direction of travel it's taking politically. Of course, is very well known for its World Cup success in football, yes. And it's known for its great wealth, but also its great poverty. So there are great inequalities in Brazil, both spatially, but also over time. And if you look at the Gini coefficient for Brazil, sometimes it's one of the worst in the world in terms of the distribution of income in that country. But how does this manifest itself in public health concerns? Because Brazil has quite extensive public health system. Its constitution makes very strong commitments to economic and social rights, of which the right to health is an important component. So just give us a little overview of some of the major dimensions of public health in Brazil.
Collective health was like a social movement in 1970, for example. In that moment, we're facing in Brazil a lot of problems related to dictatorship. Mm-hmm. There was a very hard period, but that social movement got built a lot of different positions in public health system. We got a constitution in 1988, the article of health as a universal right.
Yes.
Then we have in Brazil a universal system of health. You don't need to pay to go to a hospital or to get some medicines. It's Brazil, put Brazil in a good position in terms of defend the right of health for everyone. My field, for example, the workers' health field, but the issue of work and how can we make surveillance to the working relations and how to protect the work and how to build a very decent work site in Brazil. Of course, we need a lot of efforts to become more, to reach some areas, to reach some poor areas, but sometimes we need to fight against a lot of pressures from the new government, like to sell the public services in general, universities and public health system to the private sector. I'm not saying that private sector is bad. I'm just saying that we need to defend the constitutional right to health.
So there are many ways
everyone.
to uphold the constitutional right to health.
Yes.
I mean, what's interesting is the debate in the United States on public health is that there's not an understanding of a universal right to health. Democratic candidate Bernie Sanders has reiterated this over and over again, that it's a basic human right, right to health.
Yes.
But that argument doesn't land with everyone. And as we know, the contestation over the Affordable Care Act in the United States, who pays and how, and then even in this country with the vote to leave the European Union, there's a massive debate in the United Kingdom about potential privatization of the NHS, or at least components of it. So what you're experiencing in Brazil is a similar thing in the sense that there's an attempt to think that perhaps the private sector could come in and fund and use part of a national health system. But politically, this is difficult, and philosophically, this is difficult. If one has, a universal understanding of the right to health and the need to protect people's health, the collective health, as you call it, then it does become challenging to think about how the private sector might meet those needs. And it brings me to this question, because in this series of the Rights Track, we're talking about the Sustainable Development Goals. Sustainable Development Goal number 3 makes reference to good health and well-being. So it sounds to me like this good health and well-being fits rather nicely with your notion of collective health.
Exactly. And collective health has a close dialogue with environmental systems and studies. We have a field within the collective health that make them merge to discuss work, environmental, and health. And I think we need to cross this objective or goal with the goal to combat or tackling or ending slavery.
Okay, so that's really interesting to me. And let's just roll back a little bit. So SDG 8.7 makes reference to taking effective measures to end slavery by 2030. But if we could back up a bit, you make this connection between conditions of work and health in the first place. Now, if we then go back to think about work, it's the type of work that people are doing, it's the conditions under which they're doing it, and how that connects to health. So where in your work have you looked at, the sort of types of work, conditions of work, worker rights, etc.?
I studied commodity chains and how can we propose strategies to make surveillance in the entire commodity chain. After I studied a little bit mental health of workers and trying to find the sources of suffering experience of the workers in work site. And we care about job relations because job relations can influence the health status. We care about working conditions, organization of work, the hierarchy, the role, if it's clear or not, the intensity of the task you need to do, and the social relations within the world. The labor process can cause a lot of disease that reach the workers and goes beyond the work site. Then historically, for example, the labor process is not considered very powerful determinant of the health population.
Yeah, so you have the International Labour Organization worried about conditions of work, and you have the World Health Organization worried about infant mortality, longevity, age demographics, and all those sorts of things. But they don't talk to one another. And what you're proposing here is there's a direct connection between the labor process and conditions of health. Can I just ask you about this surveillance of commodity chain? Because it's very interesting to me. So Brazil is known for the production of quite a lot of commodities, not least of which coffee, which was really the beginning of Brazil's history is very much about coffee plantations, which, as we know, had the presence of transatlantic slavery because the Portuguese were involved in the transatlantic slavery from Africa to Brazil, and then there was a huge huge Brazilian slave population, and slavery wasn't abolished in Brazil until 1888. But at the same time, you're saying this phenomenon of modern slavery, and where labor processes, labor conditions are of such a poor level, there's use of coercion, people aren't paid for their work, etc., is connected to your work on collective health as well. And so perhaps you could tease this out, this commodity chain surveillance concept, and where you think this puts a spotlight on the phenomenon of modern slavery.
Generally, surveillance or health or public health surveillance thinks about the quality of the goods or the products. Then we need to expand this view and make a surveillance about the entire labor process behind some product. For example, sugar, you need to care about the entire process, because if you track the product's process, you will find a lot of bad conditions of work. Then we can find a lot of slavery cases within the commodity chains of a lot of products that goes around the world. For example, Brazil is a very good producer in sugar, meat, timber, corn, soybean, and if we construct a model to get people together and make surveillance in each stage of the commodity chain, we can go through and beyond the surveillance of a product. It's a way and a strategy to figure out a lot of cases of slavery, because slavery generally is related to a very beginning of some commodity chains and important commodity chains for Brazilian economy and for our economic system in general.
So you've made this connection between the labor chain, the labor process. You've made this personally. You've done it in an academic way. You're trying to raise awareness about the connection. How does this resonate with state officials? So Brazil's a federal system. You have state governments, you have federal governments. So there's a complicated levels of governance in Brazil. So let's say your surveillance reveals quite an extensive prevalence of the phenomenon of modern slavery in commodity chains. What in the Brazilian system allows authorities to address the problem?
Yeah, Brazilian system has obligations in terms of public health to take care about each kind of stage of production. It is in our law. Independent of the different powers between state, union, or federal position, states, and municipalities, each one of these has responsibilities. Every kind of complex problem needs a complex arrangement to face it. If we face a complex problem like workers' health or slavery with a simple view, it's not good, it's not enough. In federal level, for example, they are responsible to make surveillance in airports, in some ports, and some different situations and places. Municipalities, other responsibilities, and states as well, but they are connected in a very close collaboration.
So there are multiple stakeholders. There's also the private sector. So the groups that are producing these things for sale under the market have an obligation as well. And sometimes human rights obligations of countries feel weaker because international human rights law is very much directed towards state actors, a state actor model, and there are efforts underway to make companies accountable. In United Kingdom, there's the Modern Slavery Act, which requires companies to file modern slavery statements telling the government how they're trying to address supply chain activities that may involve modern slavery. But as yet, there's no sanction. So they could say, we're trying our very best. And if a company was found not to have done its due diligence, or at least there were nefarious practices in the supply chain, there's still very little legal sanction. And so you're quite right, it does require this coordination across levels of governance, but also working with the private sector as against the private sector. And it's interesting because it actually raises another SDG in my head. It raises the SDG 16, which is around governance, democracy, and human rights.
Perfect.
Which in Brazil has a long history of dictatorship, a transition to democracy from about 1985 to 89 when you had a first election, your new constitution, 1988, and a series of elections and various other things. And I guess one feature of that has been a focus on corruption as well. So we know the famous cases of Dilma Rousseff and Lula, and it's a highly contested set of cases around those presidents. But in the governance structure, in all of this joined up, there's massive opportunity for corruption to get in the way of actually doing something about those things that are uncovered in the commodity chain.
Yeah, you mentioned a very huge problem for us, Brazilian people. All of Brazilian story is full of corruption, and it's so sad to us. When Lula was elected in 2003, everyone was very happy because he was like represent a lot of people poor in Brazil, like poor workers that got there in power, and everyone full of hope. And after a lot of stories of corruption, and I think Brazilian government always make arrangements with the private sectors and big companies, not in order to develop the country, but in order to become rich. One of the reasons that Brazil is still going on a place with a lot of inequalities, very bad distribution of wealth. Brazil is a rich country, but sometimes the corruption make us fall down, block our real development, not economical development only,
but political, socially,
and cultural, and so on.
Yeah. So, okay, so we've talked a little bit about levels of governance, accountability, what can be done when these things are discovered. How does Brazil, officially define this idea, this concept of modern slavery or slave labor?
It's very important to say that Brazilian has a definition in penal code, very interesting and totally different from every definitions around the world. For example, Brazilian definition of slavery or modern slavery cover 4 main situations, and we call it like conditions analogous to slavery or simple slave labor. One definition is like degrading conditions at work, exhausting working hours, servitude, and forced labor. We make a merge of these 4 dimensions, and it really represents a very important concept in Brazil. Degrading working conditions, for example, mention of exposure of assorted risks, inadequate lodgings, diseases, lack of medical care, and so on. Exhausting working hours has to do with not only to the extension of working time, but the intensity. The servitude, it's overcharging every kind of thing that work can or need to pay for, including tools to work and so on, the trip to go to the work site.
So the worker is overcharged for those things, and therefore the work is almost worthless.
And they get
no money,
or they can't go out from the farm.
So it's like almost a debt bondage concept.
Yes, similar. Yeah. And forced labor, that is very well defined around the world, to take a person to work against free will. And this is a very important definition from Brazilian Penal Code.
And then, so what does that link then back to public health?
Public health historically has neglected this category. Brazilian system, for example, has a lot of experience in notify and create informations related to violence. But if you look for our data set, we can't find anything related to slavery. Another thing is Brazilian has a lot of actions in anti-slavery practices. But if you look for it, you can't find participations of health institutions, health professionals, and Brazilian health system. It's a problem because we can address different parts to tackle slavery and helping the system, the entire country, to end it. And another important thing is that slavery this kind of slavery in Brazil causes severe consequences in human health. Acute disease and chronic disease, mental health problem, physical health problem. It reaches not only the victims, but the family, the communities related to this person, and affects psychological dimension, physical dimension, and psychosocial dimensions.
And is there support in place? So you identify a victim, a survivor of modern slavery, they leave conditions of modern slavery. Is there then a follow-on support, public support for them, so that the public health risk is lowered, their health returns, and they find gainful employment in the Brazilian economy, for example?
Yes, I have a lot of interviews with freed slaves or rescued slaves in Brazil. If I take that interviews and compare the situation they faced with the concept of health, we can see a very astonishing thing. For example, health, it's related to life, work in good condition, water, food in good quality, not poor nutrition, a place to go, a shelter in good quality, and the stories, the narratives, the testimony that workers freed from slavery in Brazil tell me show the denial of each of these elements. Slavery is not only the opposite of liberty or freedom. Slavery is totally the opposite of a healthy situation. If we want to build a healthy society, we need to end slavery in Brazil.
So that's a fantastic conceptual connection between the two, and this notion of freedom and health and the opposites, as it were. So I wonder, has there been any attempt, and this is a very difficult social science problem, in counting the number of slaves, because this is a very contested issue, but have there been attempts to look at prevalence measures of modern slavery in Brazil? And if so, what sort of numbers are people working with at the moment?
Yeah, Brazil has a good experience in repress the crime of slavery. And since 1995, we have a lot of good labor inspectors that make a special team to go to the farm and wherever, just to make surveillance and find some case of slavery by denouncers did from civil society. Then they get a lot of rescues in that labor inspections. For example, I can say that in the last 15 years, 45,000 workers, or a little bit more, were rescued from slave labor in Brazil. It's a very good amount, but I know it's difficult to count it. The number is very big, it's not so big, but it's a result of labor inspectors. It's evidence, we can prove it. We have a lot of reports related to this. And something interesting is that 90% of the case of slavery in Brazil in the last 15 years was related to agricultural system. Then it's very important to address, and the profile of the population affected is very interesting because 95% them are men, young men until 39 years, for example, in very poor level of schooling. It's interesting because the number of women, it's not present because the Brazilian concept not reach the sexual slavery, for example,
okay,
or the prostitution or work or sex workers.
So forced sex work, trafficking, yes. Those sorts of issues haven't yet been dealt with in that sense.
Exactly. There's a different situation.
So there's a bit of a bias in the sense that there's a male bias, so you're going to get a high number of males because the focus is on males as a category. But equally, cases of rescue, inspectors, etc., are tip of the iceberg. And any statistician will tell you it's a sample of individuals. It might even be a biased sample of individuals from which it's difficult to make an inference to the larger number. So it's been really fascinating talking to you, Luis, and I wish you the best in the continuation of your work. I think what you've highlighted us today is this concept of collective health, a more holistic approach to health, the link of this notion of collective health to the conditions of work, but also the labor process itself, and this surveillance of commodity change, which is something that's happening in many sectors across the world at the moment, and the link, of course, to SDG 8.7 and how to combat modern slavery. So for now, for this episode of The Rights Track, I have to say, muito obrigado.
Obrigado.
Thanks for listening to this episode of The Rights Track, which was presented by Todd Landman and produced by Chris Garrington of Research Podcasts. You can find out more about our podcast at www.rightstrack.org. Funding for this series comes from the University of Nottingham's Rights Lab project, home to the world's leading contemporary modern slavery experts and first large-scale research platform for ending modern slavery.